We are Jack, Julie, Rejoice, Mahassan and Einal, 5 researchers in 4 locations across the UK working on a big, exciting and challenging project with communities. We are part of the CommonHealth Assets research project, a collaboration between 4 UK universities and 14 community-led organisations from Scotland, Northern Ireland, London and Bournemouth.
The project is funded by the National Institute for Health Research and aims to evidence the ways in which community-led organizations utilize their strengths, talents, and resources to impact upon the health and well-being of their communities.
Our job as researchers has been to generate that evidence with community partners using lots of different techniques like surveys, interviews, photography, and card sorts. Working on the ground in each location, we have been able to develop close working relationships with community members and organization managers alike.
Our journey as researchers started with building trust. We met with all 14 community organisations, staff and members included, making sure we were familiar faces. Keeping the organisations involved was key to the success of the research. We exchanged regular updates and ensured they felt central to the research without burdening and distracting them from their key roles in their communities. At times, we took an informal approach, grabbing a cuppa and chatting with organisation staff and participants, which created a relaxed environment.
We recruited 351 participants for the survey, which we were extremely proud of. Whether by phone, video call or in person, we were flexible to their needs and we got to know them. Not only did we manage to get so many involved, but they stayed in for repeated surveys across 12 months to capture any changes in their outcomes. Due to these positive relationships, 296 participants completed the entire series of surveys over the course of the 12 months, and it was great to follow alongside their journeys.
As researchers, we wore many hats, speaking about policy issues with community organisation managers while we handed out sandwiches to a lunch club gathering, supporting participatory photography workshops, then getting back to the desk to analyse data before reporting back to the project management group.
As the project developed, we honed our skills to be able to turn our hands to whatever was required at the time, much like community organizations are required to do every day.
One component we were particularly proud of was the Lived Experience panel. Made up of beneficiaries of our partnered organisations, the panel has made sure that community voice is at the heart of the CommonHealth Assets project.
The project goes beyond evidencing health and well-being impacts. It gave us a sense of responsibility to do their stories justice.
The evidence we have produced doesn't come from artificial trials or national statistics. When we interpret our data, we see the faces of the 300 people who took part and the leaders of community organizations surviving against the odds. We have been privileged to be there with people living in disadvantaged communities who have felt the impacts of COVID and the cost of living crisis, and that makes our data and our analysis important.
We hope that this evidence can guide policymakers, local councils, healthcare providers and organisations themselves to better support community well-being in ways that build on the unique strengths within each community.